about this boot that I was given by the doctor due to a fracture that I have on my foot. And this boot is normally given for stable fractures, grade 2 and 3 ankle sprains, post-operative use, also trauma rehabilitation, and hot and cold therapy. So for those of you that hopefully will never happen to you, but if you were curious or want to see how this boot is, I'm making this video. The boot is kind of not too heavy, but it's heavy. So it's all made of rubber here on the back. It's very large. It comes in different sizes. This is large for me. I have a size 10 foot. But they have a medium and small too. It comes with all these straps and this Velcro material and this padded material that is very soft. The first days that you wear this boot may be difficult, at least the first day, because you are carrying a weight on your foot and you have to drag it. Now, this boot also comes in different sizes besides the foot size, and there is a taller version of this boot for also for fractures in the leg. So I only broke my foot, fortunately, so I was given the lower one. But the doctor wanted to give me the tall one first, and I asked if they had something smaller, and they gave me this. Now, this is the manual that it comes with. The brand is Equalizer, and believe it or not, it's made in Iceland. Something that is surprising. And these are the instructions to put the boot on. Also, I'm just going to put it here so you can see it. And the boot is also washable, so you can wash it with time. The doctor normally recommends 3 to 6 weeks of use of this boot. In my case, I didn't realize I had a broken foot, so I walked without the boot for about 3 weeks. So when I went to the doctor, finally they told me that I needed to wear another 3 weeks. But normally the treatment is a month to 6 weeks, depends on the fracture. Now there are two kinds of fractures. There's the fracture that where the bone it's aligned, so it breaks, but the bone is still aligned. And for those kind of fractures that where the bone is not misaligned or coming out, then this boot is the recommended treatment. If the fracture involves a bone that has been moved from its position, then that may require surgery or other procedures. So this is the boot again. Besides the boot, also the nurse gave me this bandage on my foot that I had to put. It's recommended that you put it on top of the sock. If you don't do that, then you may have some irritation on the skin. So put your sock on and then this bandage in this way. And I'm going to put the boot on so you can see how it works. Just open this up like this. Just put my feet here, my foot. And then you start strapping here. See, so orientation of the camera. Here you go. Here. Put this camera a little more like this. So, and then you start strapping this to top. And it has to be not too tight, but it has to have a nice hug of your foot, so that the foot will not move around. At the beginning I was a little dubious about this. Should it be very tight? And I said no, it shouldn't be tight because that could constrict your circulation. Then you open this. Once these two are put in place, you put the first strap on in this position right here, and here's where you had to put some pressure, but not too much, just to hold the foot in place. This is another one. You do the same thing here, and then this is the third one that comes on the ankle, and you put it like this. And here you can apply more pressure, and it also comes with some optional pads that you can put below the straps in case you feel uncomfortable. And this is the boot.